Well, aloha and welcome to the COVID-19 Care Conversation brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. Good morning. I'm Yenji Denise.
And I'm Ryan Kalei-Suji. We want to thank all of you for tuning in. We see some comments already coming in. So thank you very much for, first of all, for saying good morning. Good morning to everybody. And for those of you who are already submitting your questions, joining us today will be Lieutenant Governor Josh Green to talk a little bit more about the state's efforts, some of the reopenings that are happening, and sort of the next phase of this COVID-19 pandemic. And again, we want to hear where you're watching from. We want to hear your questions as well. This is your opportunity to engage with our leaders. So we encourage you to type in your questions and to share this and like this feed so that we can reach as many people as we can to help get this information and this important conversation out there to many people. One of the things that we always like to do is provide an update with some of the totals and the counts of COVID-19 cases in Hawaii, and we continue to see those single-digit cases.
Yeah, fantastic news. Just one new case, that case on Oahu yesterday, for a statewide total of 626 positive cases. Wonderful also to see that more than 89% of people who have been infected with the virus here in the islands have recovered. We've got one of the best recovery rates in the country, the lowest death rate in the country, second lowest number of confirmed cases, second only to Montana. So it is wonderful to see those numbers. One case is one too many, but a single digit is really wonderful to see.
Yeah, and somebody who has been involved in those efforts to help to keep the public informed has been Lieutenant Governor Josh Green, who with his whiteboard has become a local social media phenomenon with his intellectual numbers and breakdown of that. Good morning, Lieutenant Governor. Great to see you. First, if you can give us an update, got to be happy with the results that continue to come in with those single-digit cases.
I am. I'll even break the news for you today. It's 3 new cases today total on Oahu. It's just 3, so that takes us to 629. And having single digits when we had 1,000 tests is extraordinary. People have done it. They flattened the curve truly. And that has kept people alive. It's kept us in the space where we can manage the disease and actually do the necessary contact tracing and testing that you want to be able to do. It's really something special. And so that's been good news. We've had 17 fatalities, which is heartbreaking. However, that is also, like you described, the lowest mortality rate in the nation. Again, there's a couple states that are similar to us, Montana, Wyoming, but they have even fewer people than we do by a large number. So we have done something extraordinary. It has come with incredible sacrifice from our people, but we will reward that sacrifice by being able to be considered the safest destination in the world. And over time, that's going to matter. But I'm sure we'll get into some of those details today. I would also mention a couple other numbers that are important. Our ventilator use remains very low. We're at 15%. We have 67 of our 459 ventilators are currently in use. As you can see, I'm looking up at my board. 110 beds in the ICU out of 244, that's 45%. These are numbers that are consistent with being able to respond to whatever challenge arises as we go into this next phase, which is restoring first the Kama'aina economy, and then at some point, having tourists return.
When we look at what the governor is now calling safer at home and we start to see these restrictions being lifted, on a practical level, what does that actually look like? How do you advise people as they sort of re-enter life to do so safely so we don't see those numbers go up?
Well, a couple things. So you are safer at home, of course. However, when you go out, because now there will be businesses that you can go to, and now there will be some shopping that can be done, and of course you'll have to resume some of your regular life responsibilities like going to see the doctor and whatnot. You will have to still wear a mask and socially distance if we want to keep these numbers low, and that's gonna remain for some time. 2020 is going to be a year where we get very comfortable with our creative masks because we are so successful that we are also not getting herd immunity, and that's a blessing. We don't want these cases; they will kill our kupuna, but we also have to recognize the fact that until a vaccine becomes available, we will have some vulnerability. So safer at home means that, and it's meant to message to people, look, even though we're opening, you will still be safer at home. And in subsequent weeks, there will be some other changes. Of course, you heard yesterday from chairperson of DLNR, Suzanne Case, who's a good friend. She expressed now you can go out in parks and you can exercise. So though you're safer at home, you can go totally insane when you're at home too long. So you have to get out, you have to exercise, but you have to do it safely.
One of the things that you brought up was protecting our kupuna, and we're seeing in other countries such as Italy, they're saying that their elderly have to stay in place potentially till November or December, just because even though people begin to go out, they're the most vulnerable population. Do you see something like that happening here, where we maybe phase out ages or demographics of people that might have more opportunity and keeping the kupuna in longer?
Well, so from a legal standpoint, it's probably unconstitutional to actually have a directive, but from a policy standpoint and just loving our kupuna, yeah, we will give advice that way. The mortality rate is over 14% for an individual who is 80 years old and older and catches COVID-19, whereas the mortality rate is very, very low for someone in their 20s or 30s, probably less than 0.5%. So it's a huge difference. The idea will be, if we have any cases in our midst, to make sure people who are more senior do minimize their contact. We will continue that message all the way through the summer. As of right now, our viral load is extremely low. We have just these 3 cases each day, and Yunji mentioned it. We've had more people getting well than we have new cases, right? So our recovery rate has been very good. We'll probably pass 90% either today or tomorrow for recovery rate. So that shrunk the number of people down very low that have the virus and are active. So it will be very difficult to catch it. But anyone who's listening, don't get overconfident, because, we can get hotspots very quickly. And if we get the wrong hotspot, like at a long-term care facility, it will kill people. If we get a hotspot at McDonald's, like we did before, it can be quick spread. If we got a hotspot at a hotel, it could suddenly affect many hundreds of people. They then go out and spread to their loved ones. So it's going to be very important that we do the social distancing and having masks, but you will get more freedom each week. Some businesses will open, some additional places will open. I'm going to fight for the opening of beaches for our immediate family, for our nuclear family, with 20 feet in between. I think that is the best recommendation that would keep people very safe. The beaches are lower risk than going to a mall that has people walking around sitting next to each other, because the heat really diminishes droplets and it kills the virus. We're not quite there yet, and we're trying to be just a little bit cautious, because you know what will happen. If the gov okays the beaches, then people have been pent up. We're going to get thousands and thousands all at once, and even if the directive is to spread out socially, it will be difficult to do. Yeah. So these are the considerations, but I want them to pat themselves on the back, because they have actually carried out a demonstration of social responsibility that saved lives. We would have had over 4,000 lives lost had we not responded with the home isolation and people listening and staying socially distanced. Over 4,000 dead in Hawaii. Instead, at that date, we had 9. And now we currently have 17.
I want to bring in the audience here. Nancy Mitchell has a question, and this is talking about something that you addressed the last time you were here, which is what testing will be required to visitors when opening? How long will it take to operationalize this? And will testing be done at departure versus arrivals? There's been a lot of talk around the world about, immunity passports. Is that scientifically even possible? What does that actually look like for a state like ours?
Yes, that is a really brilliant question, Nancy. So thank you for that. I'm working on that day and night, and have had meetings at the highest levels of government and corporations. It makes sense to do it. It may not be the only thing that we can do to keep our viral load and our cases low here, but it makes sense to do it. Let me be very specific. The best way to do it would be to have a relationship where people, when they decide to travel, with all of the agencies that sell tickets and the airlines, to tell the people that they should get a test beforehand. I'm actually not that particular, you might be surprised, about antibody versus antigen tests, the current tests, because neither will be perfect, but both will decrease by a very large percentage the number of cases that will get through. Antibody tests have a little gap the first 7 days before you know whether someone has any antibodies and therefore has experienced the virus. And the PCR test, the swab that goes into the nose. Soon we're going to have one that's just in the cheek that's based on saliva, spit. That neither of those tests are perfect either, but they will tell you quickly whether or not you are actively infected. Now, if you do that and you put people through the process, we believe it will lower by 80% the number of cases that we would miss. That would be asymptomatic people that are positive for the virus. And that will be enough to keep the curves flat and to prevent a large outbreak here. And that's obviously what I'm working towards. I know we can never keep 100% of the virus out, but we need to keep it down so low that it won't spread. So the perfect position would be to have everyone get tested, and the small number of people who don't then would go into quarantine like we have them right now, and we would test them then, and we'd have to wait out their result. The challenge is we can only do 3,000 tests a day in our state. It is very possible in 2 weeks that we will have rapid tests that can be even done, that the hotels could acquire a lot of them. I've reached out to the state of Maryland where they bought 500,000 tests to see what the prospect is of getting tests like they did. So these are some of the calculations. It is the smart thing to do. Whether or not we must do it will depend on a couple things. One, if we see the mainland US, which is our biggest market by far, continue to go up, like we're worried that they're going to go now that they've reduced their restrictions, if they're having gigantic number of cases, like 100,000 cases a day, as some people have predicted, or 10,000 fatalities a day throughout the summer, if that occurs, it is extraordinarily unlikely that we will be able to open up Hawaii to mainland US. It would just be too much risk. And then absolutely, there would have to be a confirmed negative test. If, however, they have a good summer, like a lot of people do with coronaviruses, and it dies out, and the tests are very low, then we shouldn't have much trouble at all opening tourism. So these are some of the factors. There are some rapid tests that can be done, but that capacity is not quite as rapid as you think. The test itself only takes, 5 to 13 minutes, but the machine, therefore, can only run 4 or 5 an hour on average. So you'd have to have a whole line of machines. What I envision, and sorry for this long-winded answer, but this is the big question that's going through my mind to keep people alive and get the economy fully open. The question that's going through my mind is, if we tell people all across the world, because we can't legally compel people to have a test, but we can quarantine them. If we tell people, if you have a test that we approve, you will sail right through our domestic customs and you'll go right off and start vacationing like you desired immediately. If you, however, don't have a test and we have to do a process, you could very well be in the airport for 4 to 6 hours and then may have to wait a day before you get your result. My expectation is that people will definitely get the test. And a few people will be surprised if they haven't for some reason heard of this policy. They will be surprised and they'll have to go through the process when they land. And I think that is the answer right now. But there are a couple big questions that I laid out there for you, and that is how many cases are going on globally.
What's the time frame for an implementation of any of those measures?
Well, the time frame to do that, and I'm doing this in parallel, is I'm preparing us to have a relationship. One idea that I have is, and I've begun to socialize this idea, I'm happy to share it with our sophisticated viewership today, is we can reach out to other entities on the mainland, CVS and some of the other pharmacies, and connect with them nationally so that if they run the test, it's a centralized information system, which then we could get they could print out a paper that, Keone has had his test and therefore is negative and fine, can come. We also would be able to tap into their database in a shared response. And finally, it would make it very simple because people would know where they can get the test. As you know, it's the complexity of, oh my God, I have to do one more thing before I travel to Hawaii or elsewhere. That's what scares a lot of people about my proposal. But what's more scary? Doing it right, taking a couple minutes and getting a test, and then everyone feels good, both the tourist and our community, so we know that there's no spread going on here when the tourists are here, or rolling the dice and wondering when we're going to see a surge and our mortality rate starts jumping up. Because remember, we are a state of 1.4 million people, but we're effectively a community of 12 million people annually. And 10 million of those people just float in and out. So we are no longer a small state as soon as you open tourism up. And therefore, we will we will be a reflection of other larger states as far as this global virus goes. So I am positioning us to be able to do it the moment the governor makes the decision, okay, we're serious about bringing people to Hawaii. And then it's going to be an executive decision from a group of us that will say whether or not we have the, whether we're willing to take that action and protect ourselves completely. I think as the doctor, I'm going to have to say yes, but I will let people convince me if it's overkill. If it's overkill, we don't have to do it, but that's going to be up to the people to decide.
You know, we're talking about visitors coming in from the mainland, but, you know, just locally, there needs to be a lot. I mean, you're from Kona, Yanji's in Hawaii. I'm from Hilo. Big Island represented very well in this broadcast, but people are asking, Stephen, one of them, when can inter-island travel begin? And when will we lift the inter-island quarantine period? Because there's a lot of people who have family members that they want to see locally. When do you foresee that happening?
I think that will happen later this month, actually. I think that the viral load is sufficiently low that as we're opening businesses, that those decisions will hopefully also be reflected by decreasing the restrictions of travel. There's really no benefit in my mind. If I had my way, we could open it very soon. But I do respect the governor's authority, and I think that he has to make that decision because he even has more data than I. But right now, we are pretty low risk. And I think also the mayors kind of deserve to be able to say, like, we were speaking once earlier about it. Let's say you're the mayor of Kauai, who I really think the world of. And Derek says, you know, if he were to say, I prefer to make that decision, I would have to respect that, of course, because he knows his people better. And he knows what his local businesses are prepared to have when we have this 900,000 person gorilla of Oahu. Everybody may want to get out of town and go over, and they miss Kauai, and that could be a big deal. So that's up to the mayors, but I think that we probably can safely lift it as we approach Memorial Day, and I will encourage the leadership to make that decision as long as our numbers are low.
Let's talk a little bit about testing just here at home beyond the visitors. As we start to open up, we are expecting there to be an increase in cases. What level of increase are you comfortable with, and how will we track this? Do you think that there should be more testing, be it, for the virus itself or on the antibody level, what we're seeing with Hawaii Pacific Health, for instance?
Well, I'm definitely comfortable in the single digits. That's a reflection of a low viral load in general. I would become uncomfortable if we started getting into the 20s and 30s again. That would suggest that we are no longer adequately socially distancing, and those numbers can quickly mushroom upward. I'm really impressed by Hawaii Pacific Health's decision, and to be frank, a lot of the other hospitals are quietly doing that too. They're testing large numbers of their people. What we've proposed, General Hara and I, is to have essentially a red team that can go out and test clusters very quickly. Also, as you know, the private sector kind of jumped into it, and we were able to get, I think it was 42 stand-up testing facilities right away once we made that call. Our testing capacity is adequate right now. We haven't exceeded 1,200 tests in a day in quite some time, and we can do 3,000. And that doesn't even take into account the extra antibody tests, which we can do an extra 1,000 a day through blood tests, which is going to go up to 5,000 very soon. It's a little bit of a different test, though. So we have good testing. We certainly have enough testing internally. I spoke with the director of health today, and they are planning some more surveillance testing, some background testing with some of their capacity, and that's a very good thing. They've got some fantastic minds there. I tangle with Dr. Park periodically because we're both bullheaded doctors, but she's smart and does some very good things. Obviously, I don't mean to minimize at all what her brain power brings to the table. And, a lot of the strategies are right out of very thoughtful playbook pandemic responses. And she's been around, and I know that Dr. Anderson Bruce trusts her. So we just need to complement all these things, because some of these things are straight health questions, right, which is where they're great. And then some of them become these societal questions and communications questions, because I have to communicate as the liaison to the hospitals and to the rest of the world. I have to prepare people in Europe, which I'll do today on the news and through you, and people across the mainland. We are or aren't ready to take the potential risk of travel and volume So it doesn't stop just at local testing. We are gearing up because we've gone down to nothing as far as travelers, which is unbelievable that happened and had to happen. But it will go up just as fast as you can imagine, because think of how many people want to leave where they are, where the risks are higher, to come to Hawaii where the risks are lowest.
When you talk about these testing, how soon are you getting the results that are counted in those daily counts? So the 3 cases that you reported today, when were those actually reported as positive? Because I imagine that's going to be important as we begin to reopen, that we get a good gauge of people that are taking it and the positive results coming in, and that there isn't like a 2-week lag between that.
Yeah, it's very likely now that those tests were taken either on Tuesday or Wednesday. So in the last 48 hours. We now pretty much get all of our results within 48 hours with very few exceptions. We don't need to send large numbers off to the mainland, and now our labs have all the equipment and tech to do it, and they've been really champs too. I mean, you've seen some interesting folks, good people, Misco and others that have tested a lot, and people have filled in different roles during this whole process. But the labs have been there steadily throughout, and they've done all that they can. Even the state lab, which has a different kind of limitation because they are more of a technical lab, have worked it out so that they can quickly turn over tests if we have big need for certain groups, need to know immediately. So people have done a lot of good work. It's a very interesting thing because so many people have been asked to stay home and abandon their day-to-day lives, and then a small sliver of people are working at 500% capacity, right? Because it happens to fall into their responsibility, which is good, like the labs, the first responders, a few others. So it's I want to give a shout out to them, and at the same time to people who have respected the need to be one Ohana, which is really what we've demonstrated we are. I think it's something to celebrate going forward, but I don't want to celebrate it just yet because I don't want to jinx it,
Mm-hmm.
Well, on that, and there's a practical question I think a lot of people would like to know, and this is from Judy Keith. She's saying, is it now okay to visit with family members not living in the same household?
Great question. Technically, you're not supposed to go out unless you're doing something essential. Your family members, if they live in a different household, are just as risky as meeting with strangers, that you haven't met and you're not supposed to be interfacing with, although you do have a much better understanding of what their risk profile is. What I think the best answer for Judy is that the next batch of releases, social relaxation of the rules, will be to go to 10-person gatherings again, particularly in family clusters. And my apologies to my large family on Big Island and all my in-laws, where we often get together with lots more than 10, right? We're accustomed to that, but that's likely. So I think we're going to go into clusters of up to 10. I can't say exactly when, but that may very well coincide if things continue to go very well with the relaxation on inter-island travel. We do have to get back to normal, and this is a good time to do it when our viral load is low. It's better actually for us to begin to experience a small relaxation of our social distancing long before we see what the impact of tourism, because then I can tease out each variable. I can see, okay, we're still safe with this number. We still didn't get this many extra cases as we went to groups of 10 and then larger. We're still okay with local businesses opening up based on, say, 85% success rate for social distancing and mask wearing. And then we add the next big variable, and when we go to that, and that's when people fly in from across the country, then if it spikes, we will know that that's the risk. And we will know exactly what we have to do, whether we have to screen them more, straight up stop them from coming, or whether we have to have full-on testing before people are here.
I want to get your thoughts because we had some people writing in about this, and this is on this conflict between the Attorney General and some others when it comes to the prisons. What's your take on the prisoner release? Should that continue, or is that something that you agree with the Attorney General should be stopped?
Well, let me tell you, we released 800 prison individuals, and it probably was too many. To be honest, I am very sympathetic to people that are saying, you know, we're overflowing the prisons. They weren't built for certain capacity. And I would have never, by the way, I would have never put anybody for nonviolent drug offenses in prison at all. Okay. Those people probably shouldn't be even tried, because nonviolent drug offenses, which put a lot of people in jail, should be treated with drug treatment. And someday, if I have the capacity to fully govern, that will be my position. Okay. So that would set aside a lot of the people. The problem is there's a parallel thing going on, which is some individuals, and I love these guys, but they are pushing for essentially prison reform during and vis-a-vis the pandemic. And that put a lot of pressure on through the public defenders over to the Attorney General. And that's a big number. To release about a third of the incarcerated individuals, it has challenges. The reason I didn't fully embrace that is because though I'm sympathetic to people who made some small mistake and probably didn't need to be in jail, they often demonstrate antisocial personality traits. In other words, they are super rule breakers. They're not violent, but they're super rule breakers. And super rule breakers will not wear masks. They will not socially distance. They will go out. And that means they can spread the virus. And so there was an additional idea that I thought was imprudent about releasing a lot of people all at once that they may just be going to the chicken fights, right? Which are not good, frankly. But that's a way to spread the disease. They might just be refusing to wear masks because it'll be over their dead body that they demonstrate that kind of social distancing. Well, that is something we all have to do to keep our kupuna safe. So I was worried about that. I'm sure that Claire is correct that enough is enough, because it's my understanding that one person committed a murder, and you know, you can never tell when someone's going to do something terrible, but if you have a history of violent acts, you should not be released under any circumstance.
All right. Well, Lieutenant Governor, thank you. We're unfortunately out of time. We know there's still a lot of questions, but maybe just a quick final statement that you have as we kind of wrap up here with you in your time.
Sure. So we've succeeded in phase one, which was keeping ourselves alive and preserving Hawaii as the safest and most extraordinary destination in the world. In this case, from an epidemiologic position, we've succeeded, people. So you guys are amazing. Now, as phase two reboots, let's hope that it's a V. We went down steeply. We got to come up steeply. And that will resume now that our Kama'aina economy recovers. Thank you for being patient about unemployment checks. That is improving, but it has to be perfected. Understand that the best treatment for unemployment is to give people their jobs back, and know that I'm working as tirelessly as I can for the long game for us, these next coming months for tourism and then the out years, so that any losses and sacrifices you've made this year will be repaid 10 times over in a good economy and a blessed place to live. So that's what I'm working on, and just thank you all for welcoming me as one of your leadership team.
All right, Lieutenant Governor Josh Green, thanks so much. Always appreciate you taking the time to join us, and we'll hope to hear from you soon. Aloha.
I'll be here.
Thank you. Wow, well, we covered a lot of ground, Ryan, and you know, just some takeaways, especially for those of you who may be joining us late. It sounds like they are seriously considering lifting the inter-island restrictions this month. When he talked about beaches and allowing small gatherings, maybe allowing people to gather on the beaches in groups, but 20 feet apart. I thought that was an interesting, so not the 6 feet of social distancing. You'd have to have your towel 20 feet from the next group of people. It doesn't sound like he's really encouraging family gatherings just yet. It's really sort of wait a little bit. And he is following that sort of safer at home guidance. Yes, you can start to go out, but really at the end of the day, you are safer at home.
And also talking about that visitor quarantine period and what that looks like in reopening the state's visitor economy. So we know there were a few questions that came in later. That was one of the first questions that we asked. So we encourage you to go on back, because he kind of spoke in detail about sort of his plans. I think one of the things that we've noticed, though, is that there's a lot that needs to be done there. There's a lot of nuts and bolts and logistics that need to be figured out that clearly I think the state, as well as the partners that they're going to be working with, just haven't wrapped their head around just yet or gotten to that point. So could be a while coming before we see Hawaii open up as a tourist destination once again.
Yeah, I know a lot of people have really, we love the idea of an immunity passport and giving someone a clear yes or no, you can come or not come. But you're right. I mean, the logistics of certifying a test and who gets a test and where they do it on departure or arrival and whatnot, he really talked through the details of that. And when you hear him say all of that, it's clear that it's going to be a while before we really lift those restrictions.
That's right. And again, so tomorrow we're going to be talking with UH President David Lassner. So for those of you who may have questions about the UH system, we encourage you to enter your questions and make sure you tune in. But before we leave, we always like to highlight a hero who is doing good in the community and who are helping to make this a better place with their efforts. And today we want to highlight a special group that's been doing a lot since the beginning of this pandemic.
Yeah, and that, of course, is the Hawaii Community Foundation. They've launched, oh, well, and them too. I went to the wrong one. Hawaii Community Foundation is doing amazing things, as is this group. Of course, this is Everyone Hawaii. They have been doing quite a bit of mask delivery. So they're handing out free masks tomorrow at the Varsity Building on University. That's that round building. That's One Hawaii Fitted, Pili Group, and Vai Collective. They've organized this, and it's a drive-through mask pickup. So if you don't have enough masks, as we start to open up, you need to have, they say, at least 5, because as soon as you use one, you need to wash the next one, and so on. So presuming that you go out, if not every day, maybe every other day. So go over there, grab a mask. Again, that's at the Varsity Building tomorrow. And I just want to make sure, yes, 4 to 6 p.m. It's a drive-through effort powered by One Hawaii. So we salute them for being the Hawaii hero. And forgive us for the lean here. We're still learning. We switched our streaming platform, and there are some growing pains, if you will.
That's right. Yeah. So we want to encourage you to check out One Hawaii. I'll actually be there helping to distribute some of the masks. Going to be jumping in to help volunteer. But again, yeah, there are so many things that are happening in the community, and so many great things. Another group, of course, as you were mentioning, the Hawaii Community Foundation launched its home-based child care emergency program that was powered by the Resiliency Fund, which has been a fund that has seen a lot of corporate donations as well as local donations. And the program helps to provide relief to licensed home-based childcare providers across the state. And really, it's a great way to kind of help support the community, especially with the need that I know a lot of parents are. And Hawaii Community Foundation doing so many great things in the community, and this is just one of them.
Yeah, funds are available on a first come, first served basis. So head over to hawaiicommunityfoundation.org, look under the strengthening section. They're trying to make sure that those home day cares can actually stay open, because we know that they are so important to our community when it comes to taking care of our keiki.
That's right. Again, so we want to thank all of you for tuning in. We will, again, be speaking with President David Lassner from the University of Hawaii tomorrow. So encourage you to type in your questions or tune in at 10:30. And then next week, we'll be talking with Governor David Ige again on Monday on sort of the next phases for the state reopening of their economy and some of the lifts that will be happening next week. And then once again, Scott Murakami back here on Tuesday to talk more about the efforts being made to file those unemployment claims, which we know so many of you continue to have questions about, and looking forward to that conversation as well. So until then, we'll see you. Aloha.
Aloha.